Welcome to the Healthiest Tech Talks, where we're talking about some of the biggest challenges facing healthcare organizations today and how technology can transform the way we work so that patients receive better care. I'm your host, Natalie Tollefson, Senior Director of Customer Success at Optimum Healthcare IT. Let's dive in. All right. Welcome, everybody, to our Healthy as Tech episode for this month. I am so excited to be here talking with you today about a very relevant and very hot topic within the ecosystem and within healthcare: user experience and employee experience. But first, I want to welcome our esteemed guest, Matthew Allen, who will be joining us today as a principal employee experience advisor. And we are going to be talking about something that I think every healthcare leader really does struggle with, whether they know it or not, which is how oftentimes a fragmented employee user experience is costing their organization time, money, morale, and how we can address that through a more unified healthcare tailored portal within ServiceNow. And so before we dive in, Matthew, can I ask you to introduce yourself to our audience today and maybe share a little fun fact?
Absolutely. Thanks for having me, Natalie. Really excited to talk about this topic. I really love the topic of putting the employees first. There's some great tools out there, and sometimes we put tools out there and we don't think about how to craft the experience for the employees. So that's something I'm really passionate about. I've been in the ServiceNow ecosystem for a while, but I also love the healthcare field. My dad is a pharmacist. My kid sister is an emergency room doctor, and so I love the space. Fun facts. I'm really caffeinated today. I know that you've got your coffee in hand too, but recently I started dabbling in not just coffee drinking, but coffee farming. So did a little bit of planting coffee down in Central America. So that's one of my passions, and hiking, biking, but very, very excited to be here with you today.
Interesting. Now I understand why your gift to me the other day was a bag of Central American coffee. So I am so excited to dig into that.
Yeah.
That's wonderful. Thanks for joining us today. And by way of introduction for myself, in case there are new folks here who don't know me, I've actually been within the healthcare industry as an HR practitioner and really specializing in employee experience for the past 15 years. And so this is a topic that's near and dear to my heart. And I think between Matthew and myself, and our many years of expertise, our hope is to deliver some very practical and useful value for the audience today.
Right. Passion, experience, and caffeine. What a combo, right?
There you go. That's the key to success. Thank you. Webinar done. All right. Well, let's dive in without further ado. So let's talk about healthcare. I mean, I see it all the time, right? I'll just speak from my personal experience. And, I was in a healthcare organization working with clinicians for over a decade. And for the past several years have been serving healthcare organizations from a consulting capacity. And a lot of my clients, they just complain about how fragmented that user experience is. And a lot of them are still, in a very application centric or department centric mode when it comes to delivering services, when it comes to creating user experiences for the workforce. And I think what many of our clients are seeing is that it's tiring for those clinicians and those employees when it's difficult to find information, when it becomes very fragmented, disjointed experience to get things done, because they essentially have to be, they have to be trained or they have to be around for a year to even learn the nuances of, okay, who do I ask for this? Where do I go for that? Right. And so it leads to some cognitive overload. It leads to that extra time and that frustration when really our clinicians need to be spending as minimal time as possible finding information and as much time as possible treating patients and doing what they do the best. Matthew, do you agree? I mean, what would you add to that?
That's absolutely right. Like, who do I go to, or what tool do I use, right? And it takes employees weeks, if not months, to develop that kind of tribal knowledge of which tool do I use, which one do I go to. And so part of really enhancing the employee experience is solving for that and putting the right information in front of employees at the right time, so they don't have to do that thinking about who to ask or what tool to go to. And there's just so many different tools. Recently, Natalie, you had a chance to meet in a room full of healthcare professionals, and the number of tools that a clinician might have to use. So 10, 15, 20 different disparate tools.
Right.
So that leads to lots of frustration and lost time.
That's right. And so really today we want to introduce to you and really dive into the best practice for healthcare user experience. And I get this question all the time from my clients. Optimum, what's the best practice in healthcare? And this is what it is. It's really establishing that single digital front door and streamlining that content access across all those different functions that your average employee might need to access, and reducing the noise of the experience of trying to find information and get support. And so we'll talk more about that. But transitioning a little bit, Matthew and I were preparing for this webinar, and it occurred to us that the portal strategy, if you will, the user experience strategy, it's really like a journey. And so, Matthew, tell us a little bit about the epiphany that you had as we were talking through what would be the most valuable perspective to share with our audience.
Yeah, absolutely. So one of the things that I like to do in my free time is actually getting lost. We're really outdoorsy, and so I'm just going to show a quick clip. I had a chance to go do some hiking and exploration in Central America, hiking through the forest, and just an epic, beautiful, pristine type of environment. And just, one of those things where you can't quite get your bearings because the forest is so thick and the mountains are so steep. And as I'm going through and, enjoying this experience, it kind of gets to that point where you feel a little anxiety, like I really need to start heading back. And didn't know exactly where that was. I found a map, and the map, just wanted to share it with you. It's been weathered just a bit, and the icon that says "You're here" wore off. So not only did I not know where I was heading, but I didn't know where I was. And that was just kind of a fun analogy as we start to talk about the portal journey today. There's just so much to consider in terms of what do we have? How do we take stock of the tools that we have now? How do we look at the experience that we have now so that we can figure out where we are, so that we can plan for where we're heading? We want to get unlost. And so that epiphany, I think, is a good analogy to help us figure out and take stock of where we're at in our employee centricity journey with tools like portals.
I love that analogy, and I love that you took pictures of the map and where you were, and clearly you made it home safely. So
yeah, just in case nobody could find me, right?
Right. So this is such a good analogy, and it's going to underpin how we talk through the journey. Looking at this map here, Matthew, can you talk us through the stage one, right? And audience, for those of you that are watching or listening, really take the time to self-identify. Where is your organization?
Where are you? Yeah.
In this journey? Where would you put your location marker? And then we would love to give you some tips and advice for how to move to that next stage.
Absolutely. So the "you are here" is illustrative, but we want you to think, where am I? Where are you in this continuum? And to simplify it, Natalie and I are like, oh, let's just kind of call this 3 stages, but it's really a continuum of where you're at. And stage one, a lot of organizations, particularly in healthcare, just because of the complexities of rolling something out, the various nuances of getting tools introduced, regulations, things like that, oftentimes we'll run into organizations that are still very much at stage one, which is we haven't really thought about an employee-centric strategy for portals. They might have, an IT portal, for example. I'm going to share a quick glimpse. Some of you who are, perhaps ServiceNow shops might recognize this portal. This portal is your out-of-box IT portal. And that type of a portal really helps to begin to introduce some self-service. The organizations at stage one often have shoulder taps. Come by and ask the IT guy, hey, can you help me with this? Or they might send in an email. And as they kind of move into that stage one, we might be able to get an out-of-box portal up and running. to share and be able to ask for some basic IT services. The stage 1 portal has the get help button easily accessible. One of the things that I call that button is the fire escape. It's like go straight to create an incident and don't look around for other ways to help yourself. And what that ends up with is a lot of those kind of miscellaneous high impact types of requests without helping the user really think through what it is they need, how they might be able to help themselves. And so the stage 1 portal experience really lends itself to a lot of things in your miscellaneous bucket.
Right.
Also, yeah.
I was just going to say, that's a great, picture of what that might look like for IT in a stage 1 experience. But then what about all the other departments and all the other types of things that employees may need? Those have to be found in other places, right?
That's such a great point. That stage 1 portal, it says, how can we help? And what the challenge is the scope of what an IT portal can help with is so very narrow. So if you ask for something else like badge access to a building, IT will get that ticket and they'll say, oh, sorry, we got to close this ticket down and bounce you over to someplace else. And you got to learn for the next time around that you actually need to go to a facilities email box or to a different portal. And so nothing's really centered around setting the employee up to find what they need help with. It's very disjointed. And we haven't really thought about user experience or branding or bringing together different types of help to a single place. And one other thing, just to kind of call this out, a user, an employee is going to have to know what department they go to get a certain type of assistance. And that's really, challenging for them.
Yeah, that's a great point. Being an HR practitioner for so long, that was a big aha for me in my career is, after having implemented HR systems for the organization, which are very employee facing most of the time, a lot of times these different back office departments will design a process based on their own processes. Right. And they're not really thinking about the end user first. And so everything becomes very departmental. Go to this department email box, go to this department SharePoint site, go to this, application. Right. And so I think that's a lot of what we see in phase 1. And then kind of you start to deconstruct that, philosophy, if you will, or that approach as you move along the journey. So Matthew, talk to us about stage 2.
Stage 2. So we're moving through the journey. A lot of organizations begin to understand the importance of self-service and setting up a portal instead of doing the shoulder tap, instead of doing the stop by somebody's cubicle. And instead, those departments start to see that value of self-service and start standing up portals. And then when you get is everybody gets a portal. So stage 2 is what I call everybody gets a portal. You've got an IT portal, you've got a procurement portal, you've got an HR portal, but the user still has the same problem they had back at stage 1, which is which portal do I use? And those types of experiences really take a lot of time. I think you called it when we chatted portal hop, right? Like which one do I go to? Oh, not this one, guess again. Recently stayed at a friend's house, woke up early in the morning, didn't want to wake anybody up. I was looking for sugar for the coffee, of course. And going through each of the cabinets, trying to figure out, okay, where does the sugar belong? Does it go with the baking stuff? Does it go, near the refrigerator? And, finally found that the sugar was placed conveniently right next to the coffee pot, which is where it needed to be. And that's, again, a really great analogy. We want to make things easier for employees, put it right where they're going anyway, so they find it. But otherwise, stage 2 is about opening all the cupboards, trying to find it, and it's not there. And I think that really ends up being, a lot of fatigue for the end user. It's also very costly for an organization because each of those portals in a different technology stack has an administration cost. And so with all of those different tools, there's some really great opportunities, not only to make it better for the employee experience, but also from an operational expense standpoint. A lot of productivity drain.
Yep. And I see a lot of my healthcare customers at this stage, they've realized that email is not the way to go. We need to modernize how we do service delivery. We need to make our content more available to the workforce. But they haven't quite come together as, a group of executive leaders representing the full enterprise to say, hey, what kind of user experience do we want to give, and how can we consolidate the technology stacks and the different areas where we store information. And so what I see is that a lot of our customers in healthcare are probably right around stage 2, and they're just trying to come up with a strategy for how to move to that next stage. Which would be
right.
stage 3. So let's talk a little bit about that.
Yeah. One more quick double click on stage 2, and just want to paint this scenario of somebody who's doing some business travel, right? And you need to know what your travel policy is. Can I fly anything other than coach? Can I go to that next bigger seat? Then when you're doing the travel, you also need to figure out where to submit your expense report. And you need to ask for, badge access to that particular facility. All of those things are from different portals, from different departments. But from the employee standpoint, I just know that I need to go and accomplish this task in this place for my business to be successful.
Right.
And so that type of example of all these different tools to accomplish a task really underscore the opportunity for productivity. And then I think, Natalie, the other thing that you said that's there is that requires the business leaders, the leadership from each of those departments to begin to look and take a bigger picture view of how they can make this better. And that does take us to stage 3. And stage 3 is really about putting the employee first. We're now starting to talk about, instead of, well, I already paid for this tool is the one we use, and IT uses that tool, HR uses this tool. We start to think about, well, what's the employee need? And that stage 3 pain point, we begin to resolve some of that. Where do I go to get this? Who do I ask to get this? And it starts to converge and come together. Mm-hmm. It also starts to look a lot less departmental and more about the task that the employee's doing. The onboarding experience, for example, right? Yeah, go ahead.
Yeah, no, I was thinking the same thing you were. Onboarding is one of the most complex processes in an organization. And especially when you consider healthcare, there's a lot at stake. The length of the onboarding process can directly impact the bottom line patient care and revenue, because the longer it takes to get those providers on the patient floor, the longer we're going without being able to bill for those services. And so onboarding is a great example. And I see this a lot with our clients in healthcare is it can be so overwhelming if there isn't a good underpinning of a strategy for the user experience, where to find information, where's that one place to go. That new hire may have a poor experience joining the organization, and first impressions mean everything. So I'm glad you brought that up.
Absolutely. Yeah. And as you look at our little diagram of stage 3, you'll notice the road keeps going, right? There's more beyond the stage 3. The stage 3 is really putting the employee first, consolidating that experience, and having the leaders from different organizations in the around the table. One of the things is that continuum starts to move towards an intranet convergence. In fact, recently seen a lot of clients that reach out and they want to talk about using Employee Center Pro, using the portal experience to put their employees first. And those aren't necessarily your traditional IT, platform owners or even your HR practitioners, but it even includes folks like corporate communications. And that's great because there's just a deep empathy in that for putting the employee first. And you start to see those teams come together. And that's really what stage 3 is all about. And that's really what we're excited to brainstorm on. How do we start to make this easier for organizations?
I'm glad you brought up intranet. That is such a relevant topic right now. As you said, many of our customers are challenged with that decision point of, okay, we have an intranet. It's been around for a long time. People are used to going there for information, for announcements, for employee of the month, whatever those different campaigns are and cultural initiatives are within the organization. But then they have this growing need for an enterprise service portal, a place where users can get things done, where they can complete tasks, find information, submit requests, and ask questions. Yeah. And so there's this dilemma. Okay, well, do I drive users to the portal? Do I drive them to the intranet? Do I integrate them? Do I replace one with the other? Matthew, maybe you can speak to, some advice. How do customers, how can they think about that dilemma?
Yeah, I think the digital front door, for a while there was a term going on, one stop shop. I think one stop shop is a great idea. Let's replace all our tools and just use one. But realistically, none of our organizations are able to do that. But what we can talk about is a one start shop, putting everything that the employee needs in one place, whether then we link it out or we bring together an integration of the experience so that the user only has to know, hey, I go to this one place and I can ask for the support I need. I can do the self-support and get what I need. And so those types of things mean either a clean link from a portal to an intranet, or from an intranet to a portal, kind of bi-directional, or beginning to think about leveraging a single tool for that one start shop.
And I love that you said link it out, because immediately what comes to mind is a page with a bunch of links. I think we call it a link
wall. The link. Yeah.
Yes, and it's not pretty to look at. It hurts the brain to go and read through all these different, links to see, okay, I have to interpret the words and figure out which link I need. But to the audience here, that's not what we're talking about. We're really talking about a fully integrated experience using different methods that users would expect to use in day-to-day life. And before I get too deep into that, I think it's demo time. Do you think so?
Oh, yeah. I mean, okay. I think it might be kind of fun to show just a little bit about what a stage 3 portal could look like, and how this begins to take shape. So it's super exciting to dive in and show a bit of an experience. One thing, Natalie, that you were mentioning there that's so key is to start to think about the types of content that you have and where that content lives. And so instead of thinking about the tool itself first, think about the employee, and right behind that, think about the content that the employee needs to access. So with that, I'm super excited to share with you the Pulse portal. So the Pulse portal is really moving along that continuum to stage 3, and we've done some fun things to kind of prepare this portal for being part of that one-start experience for the organization. One thing we did was we kind of gave it a brand name. So healthcare, Pulse, right? It's the pulse of your organization. Yes. And so, when you throw that in conversation, somebody says, hey, where do I go to get a new laptop? Oh, go to Pulse. Where do I go to check my time off balance? You can go to Pulse. And so it begins to, as a tool, take on a bit of a brand in and of itself, as opposed to saying go to, tool name, whatever. And then the other really big piece that's exciting about what stage 3 looks like is it takes on the brand entity. It takes on the brand dimensions, the colors, the fonts, the imagery, and really creates an immersive tool that an employee wants to be able to use on a daily basis, a place where their workday kind of could revolve around it to get what they need.
Yeah, that's a great point. I think, especially coming again from the HR perspective, culture matters. The organization's identity and the way that we're able to stay true to our identity throughout every experience really matters. And that's what is so imperative about taking care with how we design a user experience within your organization. Unlike that first screen that you showed of the out-of-box, unbranded portal, there it is. That's functional and that's great, but I think we're at a point now where retention and continuity within the employee experience is really, really important, and most executives recognize that. And so that's really what the Pulse here is meant to exemplify. And Matthew, before we dive into the functionality, what exactly are we looking at here?
Yeah, great question. So we are looking at Employee Center Pro, which is the tool that ServiceNow has introduced as part of the platform functionality, Employee Center, and then Employee Center Pro sits on top of ServiceNow, but brings together a wealth of content from across a number of different systems to really serve as a one-start shop. So this particular solution, takes all of the tools and the widgets and the structure that's available out of box, but crafts them to meet the needs specifically of a healthcare organization. So all those tool sets are there. And so we've spent a good deal of time talking about things like the brand and the content.
Mm-hmm.
So one of the neat things about Employee Center Pro is this idea of taxonomy and topics. And that means that employees no longer have to think about what department do I go to. So you see here, we've got this mega menu along the top. We've got people and talent. We've got technology. We've got workplace services. It's no longer IT and HR and procurement. It's really about what does the employee need in terms of content, and then grouping things together to make it very simple. We've got one on here for Nolan. He's a knowledge worker at the healthcare organization. He comes into Pulse and he needs to visit another facility. He can go to the parking and transportation topic, okay? Is that facilities? Is that IT? Doesn't matter. He knows he needs parking, right? It's super basic. He can go in and take a look at the content there, and he can link out to a different portal to request a shuttle. He can fill out a request to get a parking permit for while he's visiting, but it's all done from a very topical standpoint. And one other thing that's really cool about this topical structure is it doesn't just have to be IT that owns this. In fact, the employee center structure really helps to democratize that content and allow other departments to also put their services, their knowledge, their links in this tool in a way that's really easy for the user, very user-centric.
And I love that you're highlighting taxonomy. I can't tell you how many conversations I have with clients that are navigating this mindset shift. Again, if you show that old portal that has the knowledge, resources, your request something, get help, that's really speaking more to, I guess, how you access what you need. But in the new world, with taxonomy in Employee Center Pro, we're really just addressing for the end user, what do you need? and they don't have to think about whether it's a catalog item or whether it's a knowledge article. They just know what they need, and they just know that they want to be presented with all the options to be able to get what they need. And that's the key, in my opinion, about this taxonomy approach. And it's also less about, well, who do I talk to get this? Where do I get it, right? They may not understand the decades old kind of nuances of how organizations are structured in the back office and which team handles what, but they can recognize these topics. So I think that's really important. And this is a great example that I'm excited we get to share with everybody for how you can optimize the use of taxonomy for your own user experience in your workforce.
Yeah, absolutely. I think I've used this analogy. Many folks have heard me use it before. The Coca-Cola bottle at the grocery store, and the Coca-Cola bottle, you can find it, unrefrigerated at the back of the store, the fridge section, and at the checkout stand. That the goal though is that the consumer doesn't leave the store without finding Coca-Cola. And the topical structure works the same way, because you can take a piece of content and put it in 3 different places, like direct deposit, for example. I might know that I go to look for that under benefits, but also everybody who comes into the organization as part of a new hire is kind of interested in getting paid, right? So you can also put that under onboarding. And you can also put the direct deposit in there under an open enrollment category, because every year you might want to revisit that. So you can put that same link to direct deposit in a couple of different places, and the user can determine where best to find it. And you can also optimize. Okay, if people aren't finding it on this shelf, so to speak, move it and put it somewhere else. Employee Center Pro comes with some great tools like user experience analytics that allow you to look at where are people clicking when they find content. If they're not finding it, well, move it and put it more prominently. And so in the past, those stage 1 portals tend to be kind of a set it and a forget it. The stage 3 is continually optimized. You might even have content that is very seasonal. And so you can move around to optimize that to make that very discoverable. Natalie, the other thing that's really cool about a stage 3 portal is that not only is it putting the content in the user's hands, but it's also putting action items in their face. Right. It's a system of action. And so Nolan, the knowledge worker here, when he logs in every morning to Pulse, when he sees this, he's got that badge count up at the front. He has 4 things he needs to do. And there's a couple of different ways to view this, but we've put it on a widget here. This is part of Employee Center with the active items and the tasks. And what you'll see here is that Nolan needs to take a course in his learning management system. this is really great because oftentimes those tools are disconnected. And if there's an action item for Nolan, unless he goes to log into his knowledge management tool, he's flying blind. And so by bringing all those things together in this more advanced one-start shop portal, we can make sure that those action items are very visible. ServiceNow in particular is very adept at bringing together with integration hub spokes and other tools, those action items from other systems and allowing them to be very visible, including delegating to tasks to others when they're out of the office. But that system of action is really very, very prominent.
Yeah, one of my favorite features of this as well is approvals. Using Approval Hub within ServiceNow. You know, if a manager, for example, needs to do a time card approval in UKG, and they need to do an expense report approval in Concur, and maybe a leave of absence request approval in Workday, right? We can consolidate and really centralize all of those different actions and tasks that somebody in their role needs to complete and present it to them in this one unified portal experience. And that's going to help with efficiency. It's going to help move business along faster, which I think is a goal that everybody has at the end of the day.
Absolutely. Absolutely. One of the other things, and this is really key to this stage 3, this more advanced employee-centric portal, is making things very personalized based on the role of the person within your organization, the persona, what type of job function are they doing. In fact, a couple of these content items I think you curated. Perhaps you want to kind of call those out for Karen, the clinician. We're logged in as Dr. Karen, so you want to walk us through that?
I don't know if everyone caught that. Can you go impersonate our original user,
Sure.
Nolan, the knowledge worker? I just want people to see this.
Yeah.
Nolan, the knowledge worker, that could be your payroll specialist. That could be your, IT analyst, right? These are folks that are usually in front of a computer all day. And so you can see, for example, this particular portal design, which is very intentional, has 4 different quick items at the top, right front and center. And you can see for Nolan that these, pretty common things that you'd expect a knowledge worker to be able to need. And these are highly configurable. You can pretty much put whatever links you want there. But now go back to Karen, the clinician.
It's a great alternative to the link wall, right?
Yes, the link wall or the link farm, exactly. Much more preferable. So now take a look. It's the same portal, but Karen actually sees different items because in the system, she has an identity as a clinical worker. And so Karen spends a lot of her time in Epic. She spends a lot of her time looking at her shift schedule. She spends a lot of her time on the patient floor, dealing with different biomedical devices. Maybe there's an IV pump that's not working, or, maybe there's, a rover that's not working, or a wow that needs to be repaired. And instead of pushing it in a corner, let's report that issue, right? Let's report that to the clinical engineering team so they can get that fixed. So you can see that Karen actually has access to different items that are more relevant to her. And, in addition, the more that she interacts with this portal, the more that the portal will learn what she needs, and it'll present to her and to any other worker what is going to be most useful based on her activity and other similar employees like her.
Yeah, absolutely. That's a really good point. We can kind of curate those accesses to other systems. One of the other things that I'm learning about the healthcare space is really the need to be able to be mobile. And so the tool, the Employee Center Pro Portal, can be really optimized for tablets, for mobile responsive. There's even some now mobile related options to be able to make these tools very portable so that they can be of use to the practitioner, bedside or right where they need it most. So they've got that time freed up to better care for their patients.
I'm glad you brought that up. Mobile is definitely a really important consideration, and I'll even add to that. If you think about the clinician, Matthew, they're in patient rooms, all day. They're treating their patients, and they're usually working within their EMR tool, whether it's Epic or Cerner or others out there. And so for Karen and others that are clinicians, why not present this portal directly within Epic? And actually, you can do that. And we've done it many times here at Optimum for our customers. It's called EMR Help. And you can actually configure that portal experience to be embedded within the Epic session. And there's full security and everything there. So we're not jeopardizing data privacy. And so that's another option. Again, it goes back to that stage 3 of putting the employee first, meeting them where they are at. And I see you've pulled up employee profile. So I can, yeah. I can.
Well, I was just going to say, I mean, if you think about the EMR integration help, you're actually making this so simplified for a clinician. They don't have to think about, okay, I have to go over here and use a whole different set of tools to manage my experience as an employee. I actually can easily kind of go from one place to another within this whole one-stop shop experience to not only get access to the tools to care for my patient, but also to care for myself. And so this portal profile experience is really cool because if Karen, the clinician, needs to update her payroll information or her home mailing address, she has the access to see and update HR information from here. She can actually, identify what device she is working on when she realizes that it's time for her to upgrade. She can see, some of her benefits reward system. You can usually pull this in from other connected systems, so that there's a single pane of glass. And likewise, seeing things like org charts and the folks that Dr. Karen here is responsible for, using tools like Manager Hub to manage not only your patient care and your personal employee experience, but also your role in managing other employees. And so that can all be accessible from a single pane of glass.
Yeah, I'm so glad you pulled this up. When I think about, HR technology, usually, we want to provide a lot of this type of data and profile information to users through the HCM system, because that's the system of record. That's where that information gets updated. But not many organizations out there may actually realize that with Employee Center Pro, you don't have to point all the employees directly to the HR system. If you don't need to, you can pull that data directly into this unified user experience, and through an integration, display all of that data. I mean, even to the point of, if you go back to that, Matthew, and you click under, and you click under benefits rewards, and you click under the total rewards tab, even to the point of pulling some, personal or sensitive information in there, showing them their total rewards. And again, we can lock this down, we can make it fully secure, but this is just a great alternative to, instead of directing your workforce to, hey, if it's personal information related, go over here to Workday. Instead, we can actually bring that into this experience without jeopardizing the data integrity, and then give them a pathway to make sure that information is updated within the system of record if they need to make changes.
Absolutely. Natalie, the next thing kind of about a stage 3 I want to touch on. I know there's enough coffee to keep going, but we don't have enough time, right? There's so much fun stuff to talk about. But I really want to talk about kind of the move towards intranet, right? We have seen so many organizations that have come and said, hey, we want to bring corporate communications or, marketing communications to the table. What can we do with our portal? And Employee Center Pro has a bunch of widgets that allow you to help create and put content out there within the ServiceNow portal. So what I'm showing you here, Dr. Karen has a news and events tab. She can come in and take a look at news, and this news is hyper targeted. So we can direct this, for example, the article we have here is for open enrollment. So open enrollment's only for employees. We don't need to show that to contractors. It's only good for our US-based employees, so we can target just the US. And we have a certain set of benefits for, let's just say, the state of California, since that's where we're at, right? And just for California. So I can be very targeted with this particular piece of news. it's not uncommon for us to get a template for the monthly newsletter that somebody has to craft and send out, and no one ever clicks on it. And with this stage 3, we can start to take those newsletter templates and, using some of the content editing functionality that's in ServiceNow, do a pretty easy, HTML editable newsletter, and allow then for us to see who clicks on it, who gets it, what's our readership like, and in fact even favorite it or share the link, and make sure that this content that we take the time to craft is actually getting read.
Yeah, and I think that's really piquing the ears of, internal comms leaders here, because what many of them may not realize is Employee Center Pro has full content delivery and publishing functionality. So a lot of those communications that comms folks will typically create and push out through some type of campaign in an intranet, you can actually do that directly within Employee Center Pro.
Yeah, absolutely. And one of the other things that's really cool with the Employee Center Pro is the ability to do microsites. So what we're showing here is kind of the page for news and events, but so many organizations are really reliant on SharePoint. We hear this all the time. We have 10 bajillion SharePoint sites. And how do we make that all available so we don't have to go hunt through the haystack, so to speak, and find the right SharePoint site? And so there's some really cool things we can do. One is we can actually do a content deep link from our taxonomy structure and link directly to a SharePoint site from a topic like benefits. Or we can actually use microsites to create the same type of a microsite that you might do in SharePoint and have that all reside within the single tool, the single system of action. So right here, I'm going to click on read more, and it's going to open on Pulse a little bit of a microsite. And this microsite is all built with the Employee Center Pro tools. We have the ability to embed videos. You can see the content on this. It looks pretty different than this ServiceNow experience, right? Instead, now we have the ability to embed some videos. We can actually allow some event registration. For open enrollment, if you want to talk to HR before you make a decision, you can sign up for an event, add it to your Outlook calendar, and go and learn more. We also have the ability to set up different columns and blocks and add image and embedded items to allow this microsite to give just the right employees just the right information at just the right time. So it's a really cool tool as that stage 3 continues to evolve and give organizations more ability to put employees first.
Absolutely. That's such a great topic to end on with our portal demo here of the Pulse. Thank you so much, Matthew. This has been, I think, just the tip of the iceberg, right? Our goal was to outline, what are some of the really common challenges that healthcare organizations can face when they're starting to really be challenged by their user experience within the workforce, and what that portal journey is from stage 1, where there's not really much of a strategy, to stage 2, where there's a little bit too many strategies. They're not all unified. And then to stage 3, where we're really starting to talk about meeting the employee where they are and giving them a seamless user experience on a robust tool like Employee Center Pro. And so I think now's a great time to open it up to some questions. What do you think?
Sure, that sounds great.
All right. So if anybody has questions within our audience here, feel free to ask them now. And you can do that within the chat here in our public chat or our Q&A section. I mean, Matthew, what are some of the most common questions that you get from customers as they're evaluating their portal journey?
Yeah, I think a lot of it is really about, hey, I've got this type of content. How do I do this over here? How do I move from this experience? How do I get from stage 2 to stage 3? And so it's really helpful to have some expert guidance on these are the different types of content. Here's the personas that use that content, and prepare for taking some of those next steps. I also love to talk about spring cleaning. Whenever you talk about taking a step along the journey, you don't need all bajillion SharePoint sites. We can leave some of that content And instead of organizing things in silos, think instead about what the employee needs at the beginning of the day, and streamline, simplify, and prepare for moving ahead in that employee-centric journey.
That's a great point. That's a great point. The simplifying and the streamlining is imperative, because it's so easy to just get stuck in, well, this is how we've always done it. But again, to meet our users and give them the value, it requires that continuous maintenance. All right, I do see one question here. How do you see the role of portals evolving as healthcare organizations adopt more AI and more automation?
Yeah, that's a fun one. There's all sorts of ways, particularly in the world of ServiceNow, which is where we spend a deal of time. And that is, there's AI tools that the employee feels and interacts with on the portal, and there's AI tools that the user feels because the fulfiller team is able to be more efficient. Mm-hmm. So some of the AI tools that you might say are front of the house, and some of the tools are back of the house, but either way, the goal is the same, to meet the employee's needs quicker and more efficiently. So you might have something like a chat and being able to interact with the chat to get your needs met. Or you might have some AI tools in the back end actually creating new knowledge to make self-service more efficient the next time around. And one of the really cool things about that AI journey is it's not all at once, cannonball in. It's taking some progressive steps. So we were showing today the taxonomy, right? How to browse. There's a lot of users that still like that kind of Amazon experience where they browse. There's other users that want to go straight to the Google experience and search. And AI kind of bridges that gap. You have to have a good taxonomy for your content in order for AI to produce meaningful results. Right. But the AI does really kind of favor that, like, hey, let's just search or ask a question. And so there's some really great strategies that help organizations move towards that. Not a cannonball, but like wade in and begin to make the experience better for the fulfillers on the back of the house and the employees on the front of the house.
Yeah, no, I think you said that very well. And, for those out there who are really considering using ServiceNow Now Assist AI functionality, getting your portal strategy right and really streamlining that content and access to content and optimizing that taxonomy, as you mentioned, those are necessary in order to leverage the maximum benefit of Now Assist. And so this is really a stepping stone. Phase 3 might be a unified portal, but phase 4 is optimizing that experience with generative AI. And so it's all part of that same journey. Okay, we have one more question here. How does the Employee Center portal translate to mobile? Can users have the same user experience on the go?
That's a great question. One of the things that is really important is really leveraging Employee Center Pro to do your own design. There's a lot of ability to do things. The portal that we shared with you has some really beautiful CSS work. And some folks that are really sharp working on this and making the visuals responsive, being able to move things around so that it shifts from the mega menu to a hamburger menu. And so it really does translate very well on a mobile device. ServiceNow is also really investing a lot in the Now Mobile solution to allow certain bits of functionality to be exposed both to fulfillers on the back end and end users on the front end through Now Mobile. And really, I think a lot of how you want to create that experience depends on whether or not it's a bring your own device or it's a managed device. Right. But a first really good step is mobile responsive.
Yeah. Seamless experience from your desktop to your mobile device. I love it. Great. Well, we are running out of time. I know we shared a lot of information and some suggestions on next steps with each stage of that roadmap. But for anyone listening who wants to move that experience forward, one piece of advice that I would give you is start with your leaders. And maybe you are one of the leaders within your organization who has influence regarding the strategy for employee experience, and bring those different people together, not just IT, but also HR and your corporate comms and even your medical practice leadership, talking about what is that experience that we ultimately want to deliver to our users, and get aligned to that same vision. And if you're not sure what stage you're in and you want to talk a little bit more about, seeing what the right next step is for you, we'd be happy to help you. We can have a conversation about that.
Over a cup of coffee, right?
Over a cup of coffee from Central America. That's perfect.
Right on.
So Optimum does this on a day-to-day basis. We are guiding our healthcare customers with their strategies and how to achieve the business outcomes that they are looking to achieve, especially using a powerful tool like ServiceNow. So there's some information in the chat here for everyone to access. But thank you so much, Matthew, for being here and imparting your expertise in this area. I've had a lot of fun and I'm really excited about the Pulse. And to everyone listening, thank you for another great Healthy as Tech. And we look forward to seeing you next month.
Right on. Thanks a lot. Thanks for having me. Have a great day.